Welcome everybody for the new episode of Ocular Insider. Again from the beautiful place of Copenhagen, and with nice view of the harbor. And today and now I have a very nice guest, our friend, our supporter, our innovative doctor in the dry eye treatment and new protocols, Dr. Luca Vigo, one of the founder of Advalia clinic in Milano. Huge experiences, and I'm sure that today we will turn it more detailed as we announced it in one of our previous sessions. We'll go more deeper to talk about the protocols. And I know we started with Luca, very interesting research of effect of IRPL for treating of chalazions, and I would like to dedicate today's discussion to this new treatment modality. So welcome, Luca.
Thank you very much, Peter.
So I know that we started already 2 years ago with this.
It's almost 2 years ago. Almost.
So been a very nice journey creating and modifying, like you say, customizing the protocol. What are your experiences so far, and why you think that IRPL technology would help in modality of the treatment of chalazion?
Okay. Yes, Peter. I've been using IRPL to treat chalazion since approximately 1.5 years, almost 2 years, with I think very, very good results. Why I'm saying that? Because and why I believe in this technology? Because we know that IRPL treatment is effective in treating meibomian gland dysfunction. And we know also that the chalazion is a particular kind of meibomian gland dysfunction, because in this case, in case of chalazion, we have an obstructive gland with especially chronic inflammation. And so IRPL, I think that may be effective in treating also this kind of meibomian gland dysfunction, because IRPL is effective in stimulating the glands, and because IRPL is effective in reducing inflammation. And so this is what I want. And so why not applying this technology using the same handpiece, or probably not the same, because I'll tell you that I asked the company to provide me a specific handpiece with a smaller tip, but anyway, applying the same energy directly on the chalazion, why not have very good results in terms of reducing the size of chalazion or making it disappear with time? So this is what I did. At the beginning, I tried to directly put the energy to to treat with IRPL the chalazion. Of course, I put some gels on it, and two things that I think are very important, because we have to protect the cornea, because we have to use a specific corneal shield that I asked the company to provide me, like this. This is a corneal shield that we put inside the eye just before doing the treatment. It's very easy to put inside the eye, and we need only some anesthetic drops before, of course, and then I put the corneal shield in the eye. After this, I highlight the chalazion using this specific mask that depending on the size of the chalazion, I choose the perfect hole for my chalazion, and then I use the handpiece just to do 3 flashes directly on the chalazion. So I started doing this, as I told you, 1.5 years ago. At the beginning, I didn't know how many times I had to do this in order to get important improvements. But now what I'm doing is to use this technology directly on the chalazion twice the first week. For the second week, other twice the second week. And then for the third week, only once, depending also on the response of my patient. But in all my patients, I start also a pharmacological approach because I think that there is a synergistic effect between the pharmacological and the instrumental approach. And of course, I recommend eyelid hygiene. I recommend warm patches.
Okay.
I prescribe also steroid and tetracycline in almost all my cases, but the results are really impressive because after 1-2 weeks, the sizing of the chalazion reduces a lot. And another important issue that I want to 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 fix and to push is the fact that since in my protocol I do both the standard protocol to stimulate meibomian glands, and I do at the same time the Chalazion treatment, I want to achieve not only the reduction or the disappearing of the chalazion, but also to prevent recurrences. And we know are really we can have many times some recurrences in case of chalazion, because chalazion is sometimes not a disease related to this part of the eye, I mean the eyelids, but is depending from systemic issues.
Mm-hmm.
And so that's the reason why sometimes it's better not to make surgery immediately in case of a chalazion, but try to treat the chalazion before doing a surgery.
Okay, so what is the let's say I know that Chalazion has a different stages. What are the normal patients' time when they come to you? I know that the first one looks like a sty, is a little bit painful. In which moment patients are visiting your clinic with Chalazion problem?
It depends. And sometimes the patients are coming immediately when at the first stage because they feel pain, and so that's the reason why it's a sty sometimes, not really a chalazion.
It's
not acute.
Is heating.
So in this case, I suggest or recommend the usage of steroids or tetracycline, eyelid hygiene before doing anything else. Then I ask the patient to come back to my office 1 week later, for instance. I see what's going on. I see if it is completely disappearing with time, with only using the pharmacological approach. But in case no, I can suggest to apply the IRPL treatment, especially in case where the risk of recurrences is very high, or in case where I know that is present also a meibomian gland dysfunction, because I don't know, they are women with hormonal issues, because there are in premenopause or in menopause, or there are some other metabolical issues in men, or something related to this kind of disease. So in these cases, I recommend in short time also to use the IRPL treatment.
So when I summarize a little bit your protocol, you start with the premedication with a pharmacological approach. Then you based on the stage of the Chalazion, you do a first week treatment. It was a two treatment to three with the 3 sessions on the Chalazion directly, and you combine with the MGD treatment. Start that protocol.
Yeah.
Then second week is the 1 or 2 sessions.
Okay, just to summarize, the first week, first day, I do the standard treatment plus Chalazion treatment. Then I ask the patient to come back after 4 days, so the end of the first week, only to do the Chalazion treatment.
Okay.
So twice the first week. The second week, I ask the patient to come back the first day, let's say Monday, just to have only the Chalazion treatment. And at the end of the week, I do the both treatment, the standard treatment plus the Chalazion treatment, so twice also the second week. If everything is fine, I can wait a little bit and waiting also sometimes till the third um, session for the standard session where I do both
Okay.
the Chalazion treatment and the standard treatment. If something is going, of course, well, but is not enough, I ask the patient to come back the third week once or twice, depending of the sizing of the Chalazion and how my patient is going on after the first 4 sessions.
Great. So it's how it is with energy. Do you recommend to optimize the energy settings, or you just follow the Fitzpatrick skin type?
I just follow the Fitzpatrick skin's scale, and I used in all my patients the same energy that I'm using for the standard protocol. So 13 joule per
So
yeah,
there is a use on EI in our device.
yes. And the only thing that I have to say to pay attention is not to touch directly with the handpiece,
Yeah.
with the tip, the Chalazion, the skin, because sometimes it can be painful for the patient. So I suggest to use a certain amount of
Gel?
gel and go very, very close to the,
Stay in a gel.
but stay in the gel,
Stay in a
not
gel.
touching the skin.
Yeah.
Doing this, I think that the results are really good, and the patient has no any kind of side effects.
So what, for example, when we teaching our users of EI or IRPL technology, I always using a touch and then go back and counting 1, 2, 3 and flash.
Yeah.
This will also help you to keep distance always the same, not beyond the skin, and also be on safe side, not to deliver too much heat to the surface. What can be from your side, is there any side effect so far?
I had only in 2 cases some like a little burn on the skin, because probably I was too close, or I touched also the skin, but everything disappeared in a few days.
Yeah.
And so nothing happened at all. So the patient was really happy there.
So what do we say as a conclusion of this new approach? Is this a good direction to help the patient with Chalazion be prevented from the surgeries?
I think yes, because as I told you, especially in young patients where the chalazion or chalasia are a disease, because I have a young patient that, especially I have some girls that have this kind of recurrences in the chalazion onset many times. I think that we cannot do surgery or prescribe a lot of steroids anytime for every time for these patients, and for so long. And so I think that IRPL treatment may provide very good results without doing this and without arriving to surgery. And so for this patient with recurrences, with many chalasia, and also for patients that are afraid of having surgery. So for this kind of patient, or patient that prefer to wait before doing surgery because they don't want to have surgery, for this patient, I think that IRPL may be very useful in order to have very good results in a very short time.
Great. Great. Thank you so much. And I'm very happy that you share with us with your latest updates. And I'm happy to, and also hoping that we will develop more new protocols for the things that are coming. And also, you didn't mention, yes, you testing the new handpiece?
Yes, the
But
piece is wonderful because it's much more comfortable with a small tip, so you can go directly on the top of the Chalazion, and you can see what you are doing better than using the big,
yeah.
big.
So hope this the new improvement will soon come to our standard EI portfolio of accessories, and all the audience who owning EI and IRPL technology would benefit also from your new medical approach for treating Chalazion, and I know it's a very, very important part of the awful medication together with the dry eye. So thank you, Luca. I hope you enjoyed today's discussions, and I'm looking forward for the new sessions and new things that we could share with our audience, and those who following us on Instagram or watching on YouTube or listening on Spotify will invite for the next episode and sessions. Thank you so much. Have a great day.
Thank you.
Have a great
Thank you very much. Thank you.